Living more consciously includes becoming kinder to ourselves, each other and our world. I'm Dr. Kumari Valentine, a clinical psychologist, inviting you to tune in every Tuesday at noon for The Conscious Adventurer, where I'll give you psychological tips, guide you through meditations, and interview somebody to help you live a more connected and present life. That's The Conscious Adventurer, Tuesdays at 12 on Otago Access Radio 105.4 FM, 1575 AM, and podcast from www.oar.org.nz and iTunes. I'm Dr. Kumari Valentine, and you're listening to The Conscious Adventurer on 105.4 FM and 1575 AM. This month, we're talking about maternal well-being and complications during pregnancy. As many of you know, October is Pregnancy and Baby Loss Month. So my messages are that pregnancy and birth are not always straightforward, and that many people experience losses and stress, and that, secondly, we don't even have the language for some of these losses. I'm talking about, for example, the loss of the chance to have children, or the loss of a birth that you've imagined. But my message is also that we can celebrate experiences that we do have, that joy and sadness can exist simultaneously. So my meditation today is about sitting with feelings and sensations, about not judging, not changing, not shifting, just sitting. I'd like to invite you to drop your shoulders down and back. Bring your attention to your breath and notice that coming in and out of your body. Bring your attention, that spotlight, to any sensation in your physical body or perhaps a feeling. Now, when we bring our attention, our mind likes to make a commentary, start a story, right? This is awful, I don't like this, I need to do something about this. And right now, I'm inviting you to just notice, right? Imagine that you're a curious scientist who has chanced upon this very interesting sensation or feeling. You, the scientist, do not have to do anything with it. You are simply observing it. As your mind starts making judgments like, I don't like this, I can't cope, we say, thank you, mind. We notice what it's doing. Okay, it's doing the very best it can. And we bring our mind, our attention gently to simply observing, noticing it, noticing the sensation. Deep breath in, breathe out. Notice and sit with the sensation. As your mind wanders or starts to make stories, simply bring it back, neutrally, compassionately, gently, holding and viewing the sensation. Drop your shoulders. Take a deep breath in and breathe out. Imagine making room for this sensation. Imagine not struggling, letting go, being present. Deep breath in and breathe out. I'm going to count us down from 5 down to 1, and when I say 1, I'll get you to gently open your eyes, feeling more present, more here with me. So 5, dropping your shoulders down and back again. 4, tuning into the sound of my voice. 3, noticing your feet on the ground, your body in this space. 3, 2, and 1, gently open your eyes. So thank you very much for doing that with me. And now it is my very great pleasure to welcome Dr. Cindy Hall here. So Dr. Hall is a very experienced clinical psychologist working in private practice in Dunedin. Dr. Hall's experience is amazing. She's worked with a large range of populations, including for the District Health Board, for the university. Dr. Hall's taught students, including me, being a director at Psychology Associates, and also provided supervision to, amongst others, Pregnancy Help. So, Cindy, thank you so much for being here on the show.
Well, thank you for having me, Kumari.
So why don't we start with the question I ask everyone, which is, what does conscious living mean to you?
Well, it's interesting that you started out with the mindfulness exercise. I haven't heard your show before, but I've been interested in mindfulness since my training. And so to me, conscious living is mindfulness. It's awareness, more simply, I think, mental, physical, and emotional awareness. Mindfulness is something that I definitely strive for personally, and I use it a lot with my clients. I don't know how much explanation you've done in the past about what mindfulness is, but for me, in my understanding, it comes from a Buddhist practice, but it's not Buddhism. Mm-hmm. And the way that I explain it to myself, my kids, and my clients is that it's awareness in the present moment without judgment.
Right.
And that exercise that you did, it encapsulated that really interestingly. I don't know if you chose me because I do mindfulness. Maybe not. I don't know. But to me, that's the essence of it. And it's a striving for that because I think probably it's humanly impossible to be mindful all the time.
Completely. Absolutely. Yep.
And in the world today, even more difficult because there are so many things that take us out of our present experience.
Yeah.
However, it's been found to be incredibly useful physically, psychologically, emotionally, to learn how to be present and aware.
In the here and now, absolutely. And also all those benefits and connection as well, that relationships improve when we practice actually being rather than in our head.
Yeah, there's the funny thing that they talk about in any kind of relational treatment about communication. Mm-hmm. And one of the things is, and I'm observing it right now myself, is do you listen to what the person is saying, or are you preparing for what you're going to say?
Right.
And I think that is a really good example of mindfulness versus not mindfulness.
Right. And I like your point that we can't be mindful 24/7, right? So even brief pockets of mindfulness, wee snippets, wee seconds, really make a difference.
I think so, and I think that for some people who have never had the experience of mindfulness, it can make a huge difference just to have a moment.
Yeah, one mindful moment, right? So, to go back, I invited you because you're awesome, and also I thought you have just so much that is relevant to this month and this month that's so dear to my heart. So tell me about your involvement with Pregnancy Help.
Right. My role with Pregnancy Help is that I am the professional clinical supervisor. So I work for them, but I don't do pregnancy help work. So the role of a clinical supervisor is to support the people who do the face-to-face work, to do that work more, I like to say, just generally more effectively and efficiently, and be happier, healthier workers and volunteers.
And you also provide professional supervision or supervision generally to other people as well, not just organizations.
Yes, I do.
So what does Pregnancy Help do in the community?
Well, Pregnancy Help is a national organization that's got, now I just got to look at my notes because I know about the Dunedin Otago branch, but there are actually, I'm trying to think, branches in Auckland, Taupo, Taranaki, Central Hawke's Bay, Wellington, Canterbury, Dunedin, and Invercargill. So it's a national organization. And their stated purpose from the website is to provide free and client-focused practical assistance, information, and advice during pregnancy and early childhood. Now, the way that I see that it works in my experience, and again, remember, I just support the people who work there, volunteers and otherwise, to do that practical support. There's a nappy bank. They lend bassinets for the first few months after a child's been born. There's clothing and bedding that's given, but often the clients are really lovely and they'll bring it back and maybe make a trade. So I'm ready for the next size up, and they'll bring back.
That's fantastic.
And then there's also just a huge range of information for people, for women, whānau, about pregnancy, about early childhood, all the things that are related to a pregnancy.
That's fantastic.
Yeah, it's an amazing. And if you look at there's the national website, but then there's also a Facebook page for the local branch. And it's just incredible, the tens of thousands of pieces of practical stuff that they lend and give. It's a really incredible resource in the community.
Wow. That's so fantastic. Now, this is against the backdrop, though, of your interest in women's health, women's mental health, and also your interest in women during pregnancy and postpartum, right? Now, I know we've had a brief conversation over email about professional women and what can happen, as we move from perhaps being women who are used to being in control and having things that we can do, right, to things being not in our control. Tell me more.
Well, this is purely anecdotal. In terms of what I have observed over the years of working with women. And one of the things that's interesting is that I was thinking about this earlier, the idea that, the old idea that women should have babies when they're young.
Right.
And sometimes I wonder if that's not really a solid, correct idea. And one of the reasons I think that is exactly what you said. I've noticed this phenomenon, which is that there are professional women who get their careers established and intentionally put off having families, decide they want to have a family. And, one of the first things that happens is that our ability to conceive decreases as we get older. Now, women often know this, but we often still make decisions to put off that.
Yeah.
So already things are harder.
Right.
In terms of a pregnancy.
Right. And that's a good point, because it's not just, you can know that in your head, but when you really want a baby and month after month you get that, that one line on the pregnancy test, it's huge, right? And then that increases the chance that you might use a fertility treatment. And that's exhausting.
And it also, again, if we go back to the mindfulness idea, it takes one out of that experience, because so much is focused on the next possibility of getting pregnant,
charts, temperature,
Yeah, gadgets and gizmos and shots and medications and
which you need to do, you need to do. There are appointments with specialists and so on. These are all needed things, but they take up time and headspace.
Definitely. And can physiologically impact a woman in a way that then messes with her mind.
Yeah.
And that's not even to talk about what's happening in the, if there's a relationship that's related, and if there's not, then there's not that support that might be there.
Yeah.
So if a woman is a single woman a professional woman who wants to have a child, there's a whole raft of issues around not having the support, maybe not getting the support to even have a child. People think, why would you do that? You're single. That's not fair to the child. That's going to be too difficult. There are all kinds of things. And then, when a relationship becomes really focused on establishing a pregnancy, that's a really different focus than the relationship might have had previously.
That's such a good point. Yeah. So, with all of this, this sounds like a silly question, but what are some issues that can arise during pregnancy?
Well, if we're talking about the professional woman who maybe has postponed trying to become pregnant, again, what I've noticed is an increased, what I think is an increased likelihood to have psychological issues.
Right.
One of the risk factors for both postnatal depression and perinatal, which spans the antenatal period and the postnatal period, anxiety, is complications around the pregnancy and the birth. That's a pretty broad term. I would say that one of the things that can happen is, first of all, a woman has to give up a really important role, often, a working role, and is taking on one that's really different, although there may not be a clear understanding. Again, it's this thing about conceptually you can know that being a mother is different from being a worker. However, until one experiences it, I think it's hard to make that leap. So a woman is possibly going to be taken out of her kind of domain of control and experience.
And competence.
And competence, for sure. And put into a situation which may be completely foreign.
Right. And
certainly, like you mentioned before, there's no control. I mean, that's one thing that is horribly frightening, really, about having children, is, and especially when one is pregnant, giving birth, and in the early months, a woman has really no control because you don't know what that baby's going to be like. You don't know what the temperament's going to be. There could be illnesses. We know that, I was told, the best time to travel is with a newborn because all they do is sleep.
Right.
So I booked a trip in the first 12 weeks. Well, my newborn didn't sleep.
Right. Or people say things like, within 3 months this will happen or that will happen, right? And actually, things don't. So going back a step, I have a CD about complicated pregnancy. And the reason I chose that title is because I think that every pregnancy can be complicated. Like this idea, so one of my little bees in my bonnet is about this idea that pregnancy there's a straightforward way that pregnancy happens and motherhood happens, right? And actually, there are just so many complications. Not necessarily that we become agitated about these, but I think the hype out there gives us an idea that newborns sleep, right? That this will be the time of your life where you are the most radiant, right? Or whatever. There's an idea out there that can really, I think, load women up.
Yes.
With expectations, expectations that can really set them up to experience depression, anxiety, and so on. And now my understanding is that anxiety is actually more of an issue than postnatal depression. Is that right?
I don't know if I would say more of an issue. I would say, again, there's research and then there's my clinical experience. So I'll speak from my clinical experience, and we can refer to the research a little bit. I mean, basically, I think that the prevalence is relatively close with anxiety and postnatal depression. I think that postnatal depression probably still is under-recognized, and anxiety as well. One of the reasons is, I think, because a lot of the symptoms are ones that we expect of women who are pregnant or have just given birth.
I was talking to a woman in a social media forum who said exactly that she just thought, this is just sleep deprivation. This is just tiredness. This is just, lack of motivation, lack of appetite because I don't feel like, which are symptoms of depression if prolonged.
They are. Yes. And the thing about anxiety, which I think is similar, anxiety is about excessive worrying and feeling physical symptoms like the heart racing and that kind of
muscle tension.
Yeah, muscle tension and maybe sleep difficulties. Again, that's pretty common in pregnancy. And I don't know of many women who don't have some level of focus and worry about their pregnancy.
I used to say to clients, this is before I had children, I just had this awareness that I had this catchphrase, which was that parenthood is your gateway to worry, that welcome to worry. So, the stance I took with clients was, we need to embrace this rather than fight this worry. So how do you use your worry for good, not evil?
Because it's there.
Right.
And it's actually kind of supported to be there. Women are expected to be paying attention to their pregnancy. Everybody else pays attention to it. Like, all of a sudden, your body's not your own. People want to put their hands on your tummy, right? I mean, this happened to you, right?
I actually didn't mind the hands on the tummy, but I know people who do.
But you
and
become...
and people give you advice, lots of advice about your body and...
Yeah. And I'm sure would look askance if they saw you drinking something that looked like it might be alcoholic. I mean, there are all kinds of ways that women get feedback about how they should be attending to the pregnancy.
Right.
And the other thing that's
Absolutely.
interesting to me anecdotally is I think that women kind of lose themselves too, because all of a sudden the pregnancy becomes the focus, as opposed to the woman who is pregnant,
including during labor and birth, right? That the attention is on, it depends, right? But the attention can be on the labor and not necessarily even really this baby who's being born or this mother. Right? And I totally understand where professionals might be coming from, and I also need to say that there's huge range in those professionals.
Definitely.
Right. Absolutely. But I completely concur on this loss. So one theme I'm hoping to pick up this month is that there are a huge number of losses that can happen. The loss of your body, the loss of control, the loss of the birth you'd imagined. And I don't think that we really have a language for that, Cindy. I think that I think we have an idea about what pregnancy and birth are like and how we should be taking care of this pregnancy, but not necessarily a sense of that breadth of experience that can happen.
I think that you're right about that, and I do think that a lot of it possibly is around that medicalization of pregnancy. That's a piece of it, I think, which means that the actual humans get lost in the process that is pregnancy and birth.
Yeah.
And I also wonder if maybe it's just not talked about, again, because it's assumed that there's there's a way that it goes. It's natural.
Right.
It's natural. So, that comes up with breastfeeding too. I mean, one of my bees in my bonnet is how breastfeeding is presented as this really natural, easy thing.
Yeah.
And it's not for a lot of women and babies.
Yeah.
Sometimes the couple of them is just not well matched.
No.
And the other thing that can happen, which is not talked about a lot, is that these psychological problems or issues that arise with a woman can really seriously interfere with being able to breastfeed.
Yeah, completely. And to bond as well. So that's right. This pressure for things to be natural and normal really affects the shoulds that women have, that really affect how they are and their bonding with their child, their connection with their support systems and so on. So tell me, I guess as clinical psychologists, we always, we're very aware of that more severe end of things, as well as the breadth of what happens. What are the risks do you think, if mental health needs are ignored or not seen in pregnancy?
Wow.
Do you want a whole series? You want a whole year, Cindy, to talk about this?
I mean, wow. I mean, you can categorize them, I suppose. I mean, they're potentially wide-ranging.
Yeah.
And very serious.
Absolutely.
But they don't have to be. But they can be. So I would say there are risks to the mother herself, short-term and long-term. One of the risks of depression is suicide.
Right.
And that's just the way it is. Another thing is that a woman can turn to substance abuse to try to manage some of what's going on. That can have a problem just for her, definitely can have implications for a child. So we've got mother issues, and again, I only mentioned a couple extreme ones that are risks if they are unattended. There are risks to the partner. It's not as well known that there is a thing called paternal depression. And in fact, in New Zealand, almost 10% of partners of women who perinatal women get depressed.
That's a huge number. Wow.
And of course, a risk factor in that scenario is if the woman has had some kind of mental health issues. So again, another risk is that that child's going to have two parents who potentially are psychologically compromised.
Right.
And then there's the risk to the child.
Right. Short and long term.
Yeah, and again, huge and wide ranging. There can be just things about birth size, head circumference and height and weight and all those things. Generally the bigger the better when it comes to a
Absolutely.
baby. And we know that in anxious moms, babies are smaller. They're more irritable. They're more kind of reactive to stress in general. And then you mentioned the whole bonding thing. Mothers who are anxious or depressed just have a harder time connecting with their baby. And then that has huge brain effects on the baby, which can affect their IQ later on. It can affect their behavior. It can affect their own mental health. So again, the potential effects are really long lasting.
And I want to step in because I'm just aware that, women experience a lot of guilt, and women hearing this may start blaming themselves. Mm-hmm. So I want to step in and say, this is why we need to take the perinatal period so seriously. But as soon as you can, intervention is A, possible, and B, can have dramatic effects. So these are not typically locked in stone effects that are never reversible. The sooner you catch it, even when your child is not a baby anymore, you can absolutely repair that bond. You can heal the brain, right? There is just so much you can do.
There is.
So, on that note, what tips do you have for pregnant women and their supports, Cindy?
Right. Wow. Well, first of all, I guess kind of know your own history. Know yourself. Because if you are a person who tends to be anxious generally, or a worrier, or a perfectionist, or somebody who likes to be in control, I come from a cognitive behavioral background, and what that means is the way you think and the way you act affects how you feel, simply. And a basic behavioral principle is that you can probably predict future behavior from past behavior. So if you are anxious generally, it's likely that you're going to be anxious when you're pregnant, and possibly anxious as a mom. So you can kind of, again, understand that about yourself and maybe start to work on those issues.
Treatment is very possible.
It is. And it doesn't have to be something that you go and pay somebody like you or me for. There's so many avenues for treatment. There are great mindfulness relax apps on, that you can get for, your tablet or your
right.
phone. And even those kinds of things. And mindfulness is really useful in things like anxiety, and it can be used for depression too.